Hi, my name is Jen Carlquist. I'm a physician assistant. I work full-time cardiology and part-time ER medicine. And today's topic is going to be digging deeper on a patient's chief complaint. Let's take my recent case of a 55-year-old male who came in for preoperative risk evaluation. He was scheduled to have something benign, like a sinus surgery, and he was sent to us because his blood pressure was elevated, and he had a slightly abnormal EKG. So this is pretty common. People will come in with high blood pressure, and it's newly found, for example, or maybe they've had it for a while and they've been on a medication. Very rarely has the question been asked, why? Why do you have high blood pressure? And so I want to take you behind the scenes of my thought process. So the patient, we have to address them as a whole person. You can't take the shortcut of just writing the prescription, because even if you have a guy who comes in with 160/90, and you say, okay, here's some hydrochlorothiazide, or here's an ACE inhibitor, I'll see you back in a couple weeks. He's gonna come back a lot of times, especially if they have undiagnosed sleep apnea, or they're drinking a lot of alcohol, or they have a high stress lifestyle. They're gonna come back, it's still gonna be elevated. You're still gonna have the same problem in 2 weeks unless you address the root cause, which is really what I wanna talk about today. So I like to think of the patient as a tree. So here they are coming in, and a lot of times they'll have a complaint of hypertension, right? Or they'll have a chief complaint of fatigue. Now these are the leaves on the tree. I'm a great artist, as you can tell. Here's the tree branch, these are the leaves. And let's stick with hypertension for a minute. So looking deeper for the root cause on hypertension, there's some questions that we need to think about. We need to think about lifestyle. Do they drink alcohol? If so, how much? If they drink a lot, is their blood pressure elevated when they don't drink? Are they going through withdrawals? I like to ask about, what's your stress level like? Those patients that come in that have stress beyond belief, maybe they've just lost a family member, or maybe they have a high stress job and they can't figure out why their blood pressure is still high. It's gonna be high, even if we give you medications, if you don't manage your stress well. This is a huge, huge component that needs to be addressed in the visit. How do you respond to stress? Another thing you wanna think about is, what type personality are they? Are they type A? Type A, those patients don't know how to wind down. And yes, their blood pressure is gonna be elevated. A lot of times what'll happen to these patients is they will go in for a routine screening, because a lot of times they're also perfectionists. And when I say they, I mean we, because I'm definitely part of the crowd. And they go in for their routine screening and they find out that they have hypertension. And then of course, because they want to do everything right, they go home and they check their blood pressure faithfully, and they check it over and over. And if they get a high reading, they're gonna check it again in 5 minutes. And it's gonna be higher because they're worried about the high reading. And then that just cascades into this huge snowball, and then they've got all these readings right in a row, 2 minutes after each other, of hypertension. And they're gonna come in with that log because they've done their homework, they've been a good patient. But what they've actually done is work themselves up into a frenzy, and then you end up giving them medication. When they're home, their actually blood pressure is fine, when they're not thinking about the blood pressure, and then we end up causing syncopal episodes. So one of the things when you have patients that obsess with their blood pressure, and this is very, very common, is I tell them to not check it as often because it will fluctuate. I tell them to take a few deep breaths, go take a walk, instead of going to grab the blood pressure cuff. Because a lot of times that is the treatment. And lo and behold, a few days later, their blood pressure's fine, and they stop thinking about it. Now, that's not always the case, but I gotta tell you, more times than not, actually the cure is to stop obsessing about your blood pressure. That is actually the cure for hypertension, sometimes. So are they type A? Do they need to wind down? Maybe the treatment for their high blood pressure is they need to take a vacation, which is a novel concept to a type A. I also ask about diet. And now these are all things that are under lifestyle still. We're not even talking about medication yet. So diet, do they eat a lot of salt? Do they eat a lot of TV dinners? Because people don't know, TV dinners, great, they're easy, but they're full of salt. So do they eat a lot of salt? Are they eating a lot of meat? What are they eating? Are they drinking Red Bulls? Are you doing Red Bulls to stay awake? And that brings me to my other topic of fatigue. Almost every patient that comes in has a chief complaint of fatigue. And you really need to quantify this, because fatigue can be so many different things. And a lot of times, why I ask, well, why are you drinking? Why? Here's that big question again. Why are you drinking all the Red Bulls? Well, I'm falling asleep driving to work if I don't. Oh, okay, well, why are you falling asleep when you're driving to work? Because that's not normal. How many hours a night do you sleep? Well, I sleep 8 hours a night. Well, okay, if you're sleeping 8 hours a night and you're waking up tired, there's a problem. And that problem is usually undiagnosed sleep apnea, which is another thing that you have to think about with hypertension under lifestyle, because I have a gentleman who's in his 30s and he works night shift, which is also another risk factor for having elevated blood pressure, and AFib, by the way. And he's on 4 different medications to control his blood pressure at age 30. We've ruled out secondary causes. The only thing we're waiting on is a sleep apnea screen. It's probably going to be positive because he weighs, I think, 350 pounds. So by default, if he doesn't have sleep apnea, obstructive, I will be surprised. So getting back to fatigue, a lot of times these patients have undiagnosed sleep apnea. You fix the sleep apnea and then their hypertension goes away, which is awesome. But you have to be careful, because once you fix their sleep apnea and they stick with it, they're going to lose some weight. And then they're also going to probably start exercising. And then the medication that you had them on for blood pressure before is probably going to be too much. So you may have to really watch their blood pressure closely. A lot of times they'll come in saying, I just feel tired. I'm so tired. And I felt good for a while, but now I feel tired. Well, again, you got to look hard at the blood pressure. It's key. It might be too low. So fatigue, I like to ask, do you have a bed mate? Does the bed mate say you snore? Obviously, I'm going to think about under lifestyle stuff, sleep hygiene. And people don't really ask about the sleep hygiene or the bed mate, do they snore? And that's a huge, again, sleep apnea. That's a huge thing that we need to be looking for. Now, this is just lifestyle stuff. The next video I'll go into more the medical approach, but this kind of approach can be used for anything. So, for example, somebody that comes in with fatigue, if you really get down and you look at the roots for fatigue, you can look, this can go on and on. Do they have anemia? Do they get enough sleep? Are they depressed? Are they over-medicated? Do they have ischemia? Do they have an undiagnosed arrhythmia? Do they have a thyroid problem? And interestingly enough, this is also something that is a lot of times underdiagnosed. So if you have somebody who's tired, who has hypertension, get a thyroid. It may just uncover your answer. Going back to my 55-year-old guy, he ended up having undiagnosed sleep apnea. He ended up having AFib, and he ended up getting his surgeries. You have to bring these patients kicking and screaming to use the apnea CPAP machine, but once they do, and if they stick with it for about a month, they feel so much different. And in fact, I didn't even recognize him. I saw him a few weeks ago. I didn't recognize him. He was bright-eyed and bushy-tailed. He was bouncing around in the office, and I didn't recognize him.